Hello, everyone. Are you guys still okay by being staying at home? Welcome to the live broadcasting of Erufu Care, the online community medical support network. Today is our first English healthcare live talk session. I'm Shireen. In this era of information overloaded, we live in a world full of false news and information. Erufu Care is driven by the mission to debunk the myth and misconception of healthcare. By taking this opportunity, we are actually inviting the professional guests to share the accurate healthcare information and make sure the right knowledge actually can reach to the community. Have you ever had a sense that the world is like spinning around and you cannot do a balance? Or have you ever get fed up by talking very loud to your parents and yet they still ask, "Hey girl, what are you talking about just now?" Or have you ever keep feeling itchiness or irritation in and around the ear, no matter how many times you do the cleaning yourself? All this sounds normal and probably not serious to you, but actually you don't underestimate all this seriousness. We should no delay to ask for medical help on this. And today we are glad that to able to invite our healthcare partner of Erufu Care, Dr. Liew Kong Fui, to share about the common ear problems that a family doctor can manage. Let's welcome Dr. Liew.
Hello.
Hi, Dr. Liew. Hi, good evening, Dr. Liew.
Hi.
Okay, have you taken your meal?
Yeah, I have. Have you?
Yeah, me too. Same goes to others probably, okay. So before Dr. Liew start, do let me do a brief introduction on Dr. Liew. Dr. Liew is actually a general practitioner with clinical interest in ENT, ear, nose, throat, dermatology, and minor surgery. He is graduated from the University of Aberdeen, Scotland, UK in 2011 and completed his housemanship in Singapore. He has years of training experience at ENT Department of General Hospital of Kuala Lumpur and also holds a postgraduate diploma in dermatology from Cardiff University and a postgraduate diploma in aesthetic medicine from the European International University in Paris, where he get the top of his class as well. So Dr. Liew has also keen in interest in holistic and comprehensive management of his patient, which includes integrations of the latest available technology to obtain the best possible clinical outcome. No further delay, I shall pass the mic to Dr. Liew for his sharing. Here you go, Dr. Liew.
Thank you, Sharon. Thank you. So I will just load up the slides here. There we go. Sharon, can you just confirm if they're visible?
Yep, nice. Yeah, the slide is up.
Thank you. Okay. Thanks for the introduction, Sharon. This evening, thanks for joining us, folks. This evening, we'll be talking a little bit about some of the common ear problems that a family doctor or a GP can manage. A lot of the times, ear problems can be quite subtle, and then they can present in a lot of different ways. Surprisingly, a large number of ear problems actually present to GPs as we are the first point of contact with the healthcare system and the community. And surprisingly, a large number of these ear-related conditions can be managed quite well and successfully resolved within the scope of a family doctor. However, it is important to note as well that there are a large portion of potentially complicated and dangerous cases that do require an ENT surgeon to intervene. So it really depends on the situation. Allow me to elaborate a little bit on some of the common problems that your local GP would be able to manage. And then I hope that this can be useful and it can shed a little bit of light on the whole topic. So a little bit of a disclaimer from myself before we move on to the content. So everything that I present is basically no substitute for a proper consultation with a healthcare provider or a doctor, and it's not for any diagnostic or treatment use. It's more for an educational purposes, and I am presenting this information and sharing it within my scope as a family doctor or a GP. Okay, so ears. So we all have a pair of ears attached to our heads. Yeah, most of us, the vast majority anyway. So when you think of your ears, I think everybody would first think of sound. And that is completely correct and rightly so, because it is true, the chief function of your ears is probably to pick up sound for your brain and the rest of your body so that you can interact with the world. It is one of our very important senses. However, it is also important to note that it is also a bit more complex than that, and it's much more than just sound, actually. So it is true that your ears pick up a large range of loudness or volume of sound. It can be as loud as a rock concert, 100 decibels and above, that kind of thing, or it can be as quiet as like your little daughter or your son whispering into your ear. And it's remarkable how the ear can pick up on these different volumes of loudness. But not only for the hearing function, it is also very important and essential for our body to maintain balance. And actually, our body maintains balance and coordination in unison with a few other vital organs. So your eyes, they provide the visual input that we need, and then the ears provide a sense of balance in terms of how you get a feeling of acceleration, deceleration, or turning of your head in certain direction, rotation. And your muscles and joints even play an important role, because they provide a relative distance and tell your body how far your limbs are from each other. So these three main players, they work together, and the brain, a special part of the brain called the cerebellum, processes all this information and makes it smooth and helps to coordinate everything into the result, which is smooth motion and balance. And this result in something beautiful, because if you think about it, your eyes help you to track a ball that's moving in sports, and your ears work together with your eyes to keep the focus on the ball no matter where you're turning your head. That's the rotational movement. And then all this can be processed with your muscles to react, to use the racket to hit, and it results in something beautiful. You can play a great game with that. Not only that, hearing is also responsible for how we develop our speech. And speech and hearing is so important in a community in order to organize people together. And we all know with teamwork, we can achieve many great things. So yes, much more than just sound. So we move on to the common problems that ears can experience in terms of illness, which will affect the hearing and the balance both, and then cause all kinds of problems. So it is important to know a little bit about the brief anatomy of the ear. In this case, for everyone, the ear is divided into three segments in general: the external, or the outer ear, the middle ear, or the internal ear, or the inner ear. Each segment of the ear of these three have quite a specific classification in terms of function as well as location. It's not only about where they are located, but they each serve a different purpose, and hence we have divided them as such. So if you look at the green segment, this is the external ear. And I will talk a bit about the common problems that can affect this part of the ear first, and then we'll move on to the middle and then the internal. So the external ear, right on the outside, your earlobe, you have a lot of problems that can happen. Perichondritis is the one on the slide now. Essentially, it just means infection or inflammation of the outer lining of your earlobe. Your earlobe, if you actually touch it at the moment, it is kind of stiff, but it's not exactly very soft either. So this is cartilage. Most of your earlobe is cartilage, except for the little flappy bit at the bottom, which is completely mainly skin. So this cartilage is lined by a layer called the perichondrium, and the perichondrium is actually very vital to supply nutrition to the cartilage, which I will explain a bit later. But basically, for this condition, perichondritis, that outer layer, that supplies the nutrition to the inner cartilage, is becoming inflamed, more commonly than not due to infection. And surrounding the middle picture, which shows a boy who's suffering from a case of perichondritis, there are some common causes that can trigger this kind of illness. So ear piercings, the more piercings under the less clean conditions, the more likely you are to be able to experience some kind of damage like that. And then some of them can be related to burn injuries. So exposure to hot items can damage that part of the ear. And then very commonly as well, insect bites can trigger this kind of reaction. A small bite, and then it introduces some bacteria and it spreads quite fast. And also patients who have predisposition to getting more infection, those who have a weaker immune system, such as long-term diabetics, especially if they are very poorly controlled diabetics with a very high sugar on average over time. In general, your family doctor can tell if the case is a perichondritis, and if it is so, whether you need to see an ENT surgeon or not, or require some kind of hospital admission. It could potentially be a little bit dangerous. So I wanted to start with this slide. Okay, so moving on. Something that GP can manage a little bit more in our clinic. This is a case of pineal hematoma in the middle of the slide. Pineal is basically the semi-hard flappy bit of the ear on the outside, and actually the earlobe is the soft bit. Yeah. So and the hematoma is basically a collection of blood due to whatever reason within the body where it's not supposed to be. And in this middle picture here, you can kind of see it in this swelling area in the pineal. Most of the time, pineal hematomas are caused by trauma, and in this modern day and age, it has to be pretty significant trauma to that region of the face or the head, and it's very commonly related to boxing, football, rugby, mainly contact sports that are involved in this kind of high impact trauma. So it is important to know that pineal hematoma need to be managed quite fast because some of the consequences can be quite long-standing. So I will elaborate on the next slide. So as you can see here in the next slide, there's a picture of a man with a bit of a deformity in his the pineal of the ear. The shape of the ear seems to be a bit off. Now this is actually quite a experienced boxer, professional boxer, and what's happened here is that he had suffered a pineal hematoma most likely, and it wasn't the blood that was collecting was not drained in a very quick way, and it was left to collect there for a while, and this is what it can result, and this is called a cauliflower ear. Cauliflower ear, as I explained, the outer layer, the nutritious layer, the perichondrium of the pinna cartilage, it delivers the precious nutrients to the cartilage itself. So normally when there's a collection of blood, like in a hematoma in this kind of specific area, these layers get separated. And when they get separated, the nutrition isn't able to reach the cartilage. And sometimes that causes the cartilage to break down and die due to inadequate supply of all the important stuff that it needs to survive. And then this causes a deformity, which is pretty permanent. However, it can be treated with a specific, by specific methods. So it's also important to note that perichondritis, the first slide, can also cause this kind of cauliflower ear. That's these kind of complications. So another common problem in the outer part of the ear is Pineal Keloid. So yet again, we're using the term pinna, so it's the outer part of this semi-hard part of the ear, and a keloid is basically a kind of growth that is made up of very fibrous scar tissue, and in these kind of locations, normally people who have slightly more tan skin type normally tend to develop these scar tissue growths more easily in response to certain trauma, injuries, or the like. It can be treated with a few methods as well, but your family doctor may be able to treat it using some very simple small needle injections of cocktails of steroid and other medications. So maybe once, maybe twice, maybe a few times more, but it can be treated with a few simple injections, and a lot of the times the result can be quite good. Another common problem is in the outer part of the ear. That means the part just before the eardrum is also earwax buildup. In which case, I know everyone has some degree of earwax, and to be perfectly fair, the consistency and the level of moisture of everybody's earwax is always a little bit different. Some can be very dry, some can be quite porridge-like, and so on and so forth. And based on this kind of consistency, there are many methods in which can be used to clear out this earwax. Typically, they do not form in the deeper parts of the ear. Normally, in the ear itself, the body is able to push it out normally. However, sometimes they do get stuck inside the deeper parts, and then this is what we call earwax impaction. And this can cause a significant problem in terms of difficulty in hearing, and even sometimes predisposed to infections and cause balancing issues. So probably good to clear it out. In the general practice, ear syringing is a good option. You can shoot a jet of warm water at a specific in a specific way to flush out the buildup of earwax. Another good way is by using some kind of instrument that is a bit firmer, usually it's metal or something, and try and get past the collection and dig it out. And another way is you can use a technique called microsuction, where basically a very thin tube is put into the ear under a very specific visualization. So we look with a microscope, and then we look into the ear, and then clean it with this very small suction, kind of like a very small vacuum cleaner. And a lot of the times the amount of earwax that we can clean out can be quite surprising. So I'd just like to highlight the lower picture here, where we can see some impacted earwax that was dug out by myself in a quite a senior old man who actually experienced problems with hearing aid fitting. And he came and he had to check, and we dug out the earwax for him. So there's a bit of a scale there to give you an idea of how big it is. So another problem is outer ear infection. The medical term for it would be otitis externa. So if you look at the middle picture, you can see that the canal of the ear, the tube which leads from the outer part of the ear in all the way to the eardrum, the lining is, it gets swollen, it gets inflamed, it gets red, it gets painful, it gets, yeah. And sometimes there's pus as well, as infection does normally have. So normally, how do we get this kind of thing? One of the known trigger factor causes is swimming, unfortunately. And swimming in public pools, swimming in oceans, beach swimming, sometimes can be a higher risk of developing this kind of otitis externa infection. Sometimes excessive use of medicated eardrops can cause different types of otitis externa. Sometimes it can be caused by a bacteria, and it can be caused by fungus. So it's not. I think eardrops should be used in moderation. Sometimes it can be due to trauma, excessive ear digging, using cotton buds can sometimes cause these problems as well. So what is the general management? A lot of the times it can be managed by a GP as well. So what we do is normally we'll give some medicated eardrops, but within supervised and monitored parameters. So normally we will instruct quite specifically how to use them, how much to use, and how frequent. And it doesn't hurt to suck out the debris that are inside the ear as well, which are quite common for this kind of infection. Pus and can build up. So this is another picture of one of my colleagues who is doing a microsuction as well. And you can see that it's not only for earwax, it's for this kind of pus collection as well. So another problem that's quite common is also Variculosis. So what you're looking at in the middle here is just a small camera that's being targeted into the ear. So you'd imagine that the hole will be bigger. That's true, because actually it's infected. And if you look at the top of this hole, you can see that there's a bit of a lump here. And this is actually a boil inside the ear. And we know this as Variculosis, which can be very, very painful and can be treated quite reasonably with the right application of antibiotics by your GP. So that was the outer ear or the external ear. Let's move on to the middle ear. The middle ear, which is highlighted in blue here, essentially is an airtight box with a little tube that connects this airtight box to the outside world, and hence is able to balance the pressure in this airtight seal box. So it's also pretty important to note that inside this airtight box is some combination of bones that help to transmit vibration from your eardrum to your nerves in the inner ear. And then this messenger of combination of bones is very important for this transmission of vibration into sound, which is what the brain reads through the nerves. So let's continue a little bit to the middle ear. So as you can see in this middle picture, this blue part here in the middle ear sometimes can be infected. And if it's infected in a short period of time, we call it acute otitis media. And if there's pus, sometimes we call it acute suppurative otitis media. Either way, it is an infection, and very commonly can be treated by your general practitioner as well. A typical scenario would be when a young child may be suffering from a cold or or some kind of flare-up of their allergies with the nose symptoms, sometimes may present with some ear pain to us. You can bring them in and then they will say, I'm very ear very painful, or this is most likely going to be otitis media. And we can actually get a quick look in the ear using our tools, and we can probably figure that out. Very easily addressed with the right combination of medicines, including an antibiotic most of the time, if we think that the cause is a bacteria. But you must be wondering why, when you get nose problems, you get an ear infection. Well, that's because of that tube that helps to balance this airtight box that connects to the back of the nose, which is called the eustachian tube. And a lot of the times in health, this eustachian tube can be opened and closed quite well. If you look at this picture here, you can see that the opening comes somewhere around the back of the nose in the area that we call the nasopharynx. And in health, normally it can open and close quite well to balance this airtight box pressure. However, when your nose is not well, the lining of the inner part of your nose tend to get a bit swollen, a bit inflamed, and sometimes it can block the opening, causing lots of pressure problems, build-up of pressure or imbalance within this airtight box. And sometimes these germs that line the inner part of the nose, they can crawl all the way, which is not very far, up the tract and into this airtight box and start infecting the airtight box, which is arguably quite a conducive place for these bacteria to grow as well. In the same vein, the adults, it is not uncommon for adults to get middle ear infection or otitis media as well. And typically this would follow some kind of respiratory infection or a cough or a cold. Yeah. So still on the topic of otitis media, basically the infection inside this airtight box or the middle ear. If it goes on for too long and it's not able to be settled in, like maybe a few months or so, then sometimes it can progress to what we call a chronic suppurative otitis media. It's important to know that within the ear, there are a lot of, it's a very complex space, and there's a lot of important stuff around this part of the ear functionally. So if the infection spreads in a dangerous way, it could affect any of these very important structures around the middle ear. So as an example, the middle ear is a space here, and if you see my pointer going up into this blank cavity here, it's actually not shown in this picture, but that's actually where the brain should be. So in reality, it's only it's a very short distance just for the bacteria to kind of move upwards and get into the brain. So it's not very good for that to happen. Yeah. So middle ear done. I think moving on to the inner part of the ear, or the orange part now. The internal part of the ear is mainly a sensory bit, which is responsible for the hearing and the balance. Yeah, and they transmit along the sensors to the nerves, which go straight to the brain, and it helps us to interpret all this information. So you must have heard me mention quite a few times already, hearing, balance, hearing, balance. So obviously when the inner ear gets sick, then you will have hearing and balance problems. So the first one that we'll talk about is if the fluid in the sensory part of the inner ear gets a bit too swollen, sometimes it can cause a combination of 3 symptoms: dizziness, hearing loss, and a bit of a buzzing sound or a ringing sound, which is quite annoying, which we call tinnitus. And this is a combination that we know as Meniere's disease. And relating to the dizziness that is caused by the ear, most of the time patients experience a very specific kind of dizziness that looks kind of like the eyes are spinning and the vision is spinning, and this is known as vertigo. However, it's also important to know that not all causes of vertigo are related to the ear. So it's good to get your doctor to check it out. Yeah. So another very common internal ear related problem is BPPV, benign paroxysmal positional vertigo. So essentially what's happening is that the part of your ear which is responsible for balance, it's filled with some salty kind of liquid that helps to regulate how your ears perceive turning motions of your head. So sometimes the salt water, the salt within the water, it can sediment, and when it sediments in certain specific areas, it can irritate the sensory bit of the balancing part of your inner ear, and this will result in some kind of haywire firing of this sensor, and it result in inappropriate feeling of movement, and this gets translated into kind of dizziness, which is vertigo. So how do we know? It's so deep in there, and honestly, like sediment may not even be visible to the naked eye, but we can. There are specific tests that have been developed, and they are quite established ways of being able to tell whether the vertigo that is being experienced is most likely due to these salt sediments or particles. So that these tests can normally be done in clinic, and to an observant eye, they're quite accurate for this diagnosis. So surrounding this middle picture, you can see me kind of twisting a young lady's head in a few ways. So what's happening here is that this is a maneuver that I'm doing called canal lift repositioning procedure. So what's happening is that we're trying to turn the head in a very specific way to reshuffle the salt sediments from the inappropriate areas within this small bit in the inner ear back to an area where they will not be so irritating to the sensory system. And a lot of the times, if done carefully, it can have a pretty good result. But it has to be quite specific for certain conditions like BPPV. Another common condition in the internal ear is just like infection in the outer ear, otitis externa, infection in the middle ear, otitis media. There's also a version of infection in the internal part of the ear, but this one is not really called an otitis anything. It's called acute labyrinthitis. A lot of the times, it can follow an infection from another part of the ear or the nose or the throat, and as would be expected, there will be hearing symptoms and there will be balance symptoms. It's also important to note, sorry, I'm just going to go back to the other slide, that acute labyrinthitis is potentially quite a dangerous sort of condition in terms of hearing function outcomes. So it is important to get it addressed, at least get a family doctor to see it. And then if they think that it's acute labyrinthitis, they may want to consider some kind of further discussion or specialist management, if you will. And so just a little bit tracking deeper some more into the ear. Instead of the sensory balancing and hearing part of the ear being inflamed or infected, you can also get slightly deeper to that, where the balancing nerve is inflamed. And then this is known as vestibular neuronitis. And sometimes that can cause vertigo as well. So Hearing can also be affected in the internal part of the ear. There's quite a lot of causes for hearing loss, and it really depends on a lot of factors like age and what kind of work is being done, with relation to environmental and occupational exposures, work-related environment, and various other factors that may give a doctor a clue as to what could the most likely cause be. As a family doctor, we most likely would be able to classify what the most likely cause of this hearing loss could be. And it gives us a general idea of what the most likely cause is. And when we know what the most likely cause is, then we know where to start searching for a cure for the underlying cause. So some of the pictures around this middle picture show some of the tests that we can do. And I think I've omitted the most obvious one, where your family doctor can actually use the light and the little tube to look into your ear directly to see if there's any problem. Yeah. Aside from that, some clinics may even have a hearing measurement machine called an audiogram. So if you can get that done, you're fortunate enough to be able to get the audiogram done, then it's able to show different levels of hearing loss in either ear at different frequencies and at different loudness levels. And normally the pattern of this kind of hearing loss give us a good idea of what the most likely cause could be. So of course, as a family doctor, we also see a large amount of children sometimes, and a lot of the times when we go through our routine checkups for kids for vaccinations, or when we're just monitoring them to see whether they're growing properly, or just having a chat, or maybe they're having a cold or anything, it's not uncommon that sometimes some concerned parents may be asking questions concerning their child's hearing. Sometimes they can be picked up on routine screening, where we check for how well the child is developing. Sometimes maybe it's not so obvious, and then parents will mention it. I think it's also important to note that most Malaysian healthcare facility will have tested newborn babies for some form of hearing loss at the very time that they're born. So this is something that is very good. However, sometimes they develop this kind of hearing loss after they're born. And there are so many causes of hearing loss. And it's actually very important to be able to have proper hearing for a child, especially during their developmental years, because hearing is actually very instrumental in being able to develop proper speech. And obviously not being able to hear properly in class and so on will affect not only academic performance, but also very basic communication ability and so on and so forth. So there are a few ways that can be used to test children's hearing to confirm what the most likely hearing loss cause could be. But I don't think it's within the scope of this at the moment. Yeah. So you have an ear concern. Now I must be causing a bit of confusion as well. So who do I see now? You have an ear problem. Do you see your GP or your family doctor? Or do you want to go straight to your ENT surgeon? The answer, not so clear-cut to me. As a GP, I would suggest that it's probably more appropriate if you feel that the condition is not too much of an emergency, that you probably want to see your GP or your family doctor first, at least, because a lot of the times these ear conditions can be addressed quite effectively by your family doctor or your GP. However, if it's not something that we can treat successfully, I think that a lot of the times we can actually recommend what needs to be done next. So seeing a GP first is a relatively safe bet. There are a lot of conditions, and many conditions, that an ENT surgeon is actually the most suitable doctor to handle. However, a lot of them will involve very generally more complex issues. So yeah, I think it's appropriate, if it's not too perceived to be too much of an emergency or too serious, that you can see your family doctor first. Okay, so that brings me to the end of my sharing. Yeah.
Thank you, Dr. Liew. Thank you for your sharing.
Yeah, that's
okay,
fine.
Thanks also to the friends that is still with us online. Now we actually open for the Q&A section.
Yeah.
Please do drop us your questions in the comment below. Okay, but before I get their questions, I have my question first. Okay,
yeah.
Because just now Doctor talked about kids. Kids is the one that actually they don't know how to express themselves. How, by your experience, how parents actually can detect they are having ear problems and able to seek for the medical help as soon as possible?
Okay, thanks, Sharon. So it's a very important and good question. I think more often than not, parents themselves will be very concerned, and this is because sometimes they suspect that their child is not developing in a normal way. It can be sometimes in comparison to if it's not the first kid, sometimes maybe it's the second and the third or so on. They may say, hey, how come my child is not developing like my oldest, my firstborn? So there's a suspicion there. Sometimes parents most of the time parents can pick up these things. Common, very specific signs would be like when the child is not responding to a parent's call, they don't turn their head even when being called, and when they're at an age that they should be old enough to recognize their name, and when they call them and they're not in their vision, field of vision, the child is not able to respond. That's a very common sign. Most of the time it's got to do with the communication and interaction, which is not that normal for children. So if not able to hold a conversation, or they're not developing their speech as they normally should, maybe when they go to kindergarten and they're not able to pick up, or they don't make friends, or they can't learn words. A lot of the times that may be a little bit late. It's good to when they come earlier than later, then the correction can be done better.
Okay. From all the actually diseases from external, middle ear and inner ear disease, actually this will be also gets infected by kids, right? It's not like only adults that actually will have such diseases.
Oh yeah, definitely. I think for most of the condition that we discussed just now, most of them are quite applicable to all age group.
Oh, okay. Okay. I think Dr. Liew, you stop share the screen so everyone can view.
Okay, thank you. All right.
No, you stop share the screen. Okay, then we continue the session. Okay.
Oh, cool.
And one question from the live. Doctor, how often do we need to clean our ears?
Okay, this is a bit of a variable one. I think by right, like it's very variable because some people, they, as I mentioned, the ear can be self-cleaning one. Like sometimes in certain people, when the ear passage is quite straight, the body can push out the earwax naturally. But in certain people, when in certain instances, let's say the ear canal is not that straight, the shape of the ear canal, then it's not that easy for the body to push out this earwax naturally. And then that is when we need to kind of give a bit of help and help to clean. So it really depends on the situation, and depending on what is the cause, that will really give us an idea of how frequently it needs to be cleaned. As far as I know, as a family doctor, I don't really recommend any hard and fast frequency for cleaning. It's not really like something that you have to do like consistently for everyone.
Okay. How about using cotton bud? Actually, there's been a lot of argument online informations that we shouldn't use cotton bud to clean our backs, especially those. I mean, not for the dry one, for the wet one. What is the way for them to do cleaning?
Yeah,
Since it's not advisable, how come cotton bud is being produced?
Well, cotton bud is, I don't think cotton bud is specifically designed to be inserted into the ear. A lot of other uses for cotton bud. And I think that for me at least, I don't think that it would be encouraged to poke and prod around inside too deep, because a lot of things could go wrong. Maybe example, the cotton may not be like 100% clean, and then you can introduce some bacteria. A little bit too forceful, you can damage the lining of the ear canal. Sometimes you can push earwax, which was going to come out, you can push it all the way in, and then that could cause problems. And some people who are too aggressive in cleaning the ears, they could even damage the eardrum. So in general, not too encouraged. However, I do understand that sometimes it can be quite itchy and quite irritating. So normally I would recommend you can protect your ears from water and products like irritating shampoo and so on if your ears are very sensitive, to prevent them from getting irritated and dried out. You can use like for swimming, earplugs, for like showering and so on. You can probably try to like coat some cotton, small amount of cotton in like some waterproof kind of ointments or like Vaseline, and then you can just fit them into the ear to protect them from too much moisture.
Okay. And probably I ask another questions about the elders. So is it because elder, when they start aging, they start losing their hearing ability? So it's not totally hearing loss. Should we get them a medical help, like putting on the hearing aid? I mean, should you advise? I mean, what should the son and daughter do if they found their parents having a weak hearing problem?
Okay, yeah, good question. I think regarding hearing loss, there are so many things that can cause the hearing loss, and arguably it may be a little bit out of a family doctor's scope, aside from starting off the ball rolling in terms of getting a general idea on what the most likely causes could be. A lot of the times, hearing loss have to be managed mainly by the ENT doctor and the audiologist. And specifically regarding hearing aids, when it comes to hearing loss, there are a lot of degree, a lot of severity of hearing loss. So some people, they may be able to, maybe they cannot hear a whispering sound, but they can hear the rain falling outside. They can hear the car driving by. Some people, they cannot hear the whispering sound. They cannot hear the car driving by outside, but they can hear at a rock concert. So it really depends on the level of deafness, and what is the most likely cause. Some conditions are not that suitable for hearing aid also.
So for elders, actually, when you found that they have weak hearing loss, I mean, we should bring them to see a family doctor to check out first before go to a specialist, right?
Yeah, why not? I don't see the harm. If we suspect that it's something that we can't manage, I do believe that we will send them appropriately on with some idea of what could the most likely thing be. I don't see any harm in that.
Let me check. Okay, we're still waiting some question. Maybe I ask another question. because as a diver myself, okay, we do experience pressure that actually hurts our ear. And then maybe after dive that actually we are facing, some people that actually facing blood that coming out from the ear and there's a pain. So usually who should we consult? I mean, can we just go for a family doctor before I really go to specialist? Because I think ENT specialists always need to make appointment first, if not wrong. Yeah.
I think it depends on the specialist as well.
Okay.
You know, but I do think that there's no harm yet again in seeing your family doctor first. As I said before, if it's something that we feel is the problem is outside of our scope, we can always send them along later. By and large, a vast majority of ear problems are not super like urgently needed to be treated. So generally, there is a little bit of window in terms of time. So specifically for diving related hearing loss, most of the time it's due to some kind of imbalance pressure within the airtight box that I was talking about, the middle ear. So it could be problems with the eardrum, or it could be just the imbalance between the airtight box and the outside. But most of the time, these things happen because of the difference in the pressure during diving and when you come up. They're very similar to the difference in pressure when you are at the ground level and you take off into the air when you're flying. So sometimes it's easy to rebalance the difference in pressure. Sometimes it's not so easy lah.
Okay. There's another question from the viewer. Okay, what do you think of ear candling? Is it advisable?
As a doctor, I don't recommend lah. It can be a bit dangerous lah. I wouldn't really recommend it from me lah.
Okay, let me check out. Is ear candle? Oh, there's two same question about ear candling. Okay, doctor, not really the advice, guys. Okay, another question. Is it painful for a child who suffer from otitis media?
It can potentially.
Yeah. From Ili Chong.
Okay. Thanks, Lynn. I think it can be potentially quite uncomfortable to painful for children. A lot of the times, especially for children who have not yet developed capability to speak properly and communicate, this can be a bit of a very great worry for parents. And sometimes they don't know why. Child is just like crying and there's something wrong, but not sure exactly what is the problem because the child can't tell you also. And when you look at the child, there's like nothing obviously going on that you feel is wrong. So sometimes it is actually very difficult to determine in that particular age group. And pain can sometimes be the only thing that we know. Yeah, that is actually a quite significant sign.
Okay, we have another from Osman. How can we manage to take out insect like ant went into our ear?
Yeah, sometimes it does happen lah. Sometimes we can get certain insects very adventurous and go inside the ear. Most of the time, from a GP clinic, we can probably like we can drown it if it's still alive, because if we try to pull it out before it's actually properly did, sometimes they can use their pincers and kind of hold on to the important bits in the ear, and as we pull them out, it could be a bit of a problem lah. Pain aside, it could be quite damaging lah. So aside from that, so different methods can be employed lah. I think as long as they can be removed with as little damage, collateral damage as possible, I think is okay. For me personally, in my practice, normally what I do is I will visualize very clearly what the offending insect is in the ear. I may not be able to tell what kind of insect it is, but most of the time I will attempt to kill it most of the time first. So when it's not struggling, it's not trying to bite you anymore, we can deal with how to remove it after that based on the size. And most likely it's going to involve some combination of instrument clipping and pulling it out, or some form of microsuction. But definitely you need to see it clearly for me.
Okay. So throughout your practice, it's very common that you met such cases of insects going inside the ear?
Not for me particularly, but it's not uncommon. It happens quite frequently in certain areas.
Okay. Another
I think
question.
it's important to note though, sorry, I just want to add this one, Sharon, that
Okay. Yeah, sure, go ahead.
Stuff that get in the ear, most of the time they can be removed by your family doctor. But I think those things that can cause quite urgent danger to the ear need to be assessed by a specialist quite fast. One very specific thing that can get stuck in the ear that you need probably to get addressed by a specialist very fast is actually things like small batteries.
Oh, okay.
Yeah. So why? Because things like small batteries, they may have a bit of an acid component inside the battery. And a lot of the times when they get stuck in the ear, they start to leak. So when that happens, after a few hours or so, it can cause quite significant damage. And the groups of people that get these batteries in the ears are most of the time little people, children. So it's quite precious the ear during that time. So you don't want the acid to get in the ear. You need to get it removed very fast.
So you don't advise as well, parents actually tends to pull out the things from the kids' ear, right? Because they might not doing a proper procedure, right?
I think
what's your advice?
My general advice would be if you can remove it by yourself, you probably could, no problem. But make sure that you can see it and don't cause any extra damage in the ear.
Don't keep pushing it in back.
But no harm, no harm. If it's very outside, let's say it's a small bead or something, and you can scoop it out, no problem. Let's do it. I don't think it's a problem. Yeah.
So another question, will sinus cause any damage to ear or hearing loss? Sinus cause any hearing loss?
Okay. Possible.
Okay.
Because as I in one of those slides earlier, there was like that tube that connect from the back of the nose.
Eustachian, yeah.
Yeah, the eustachian tube. So when your nose and your sinus area is the nose and the nasopharynx, the sinus areas are all infected and irritated, sometimes they can affect the middle ear and cause an interruption in proper transmission of the vibration of the sound going to the nerve. And that can actually cause hearing problems. Yes, it can.
Okay, I think this will be the last. Let me check out. No more question from the floor, I think. And any advice, last advice that you give to our publics about the ear, how to take care of the ears, probably, before we end?
Okay. Please, if you have any concerns about something that's not right in your body, not pertaining particularly to the ears, but anything at all, I believe that most people will know their own body the best because it is your own body. It is arguably a very intimate tool for you to interact with the world. So you know your body the best. And if you feel that something is not right, don't hesitate to talk to your family doctor, who will be able to connect you. If they can't deal with it, they will be able to connect you to the entire healthcare system and somebody who can.
Okay. Yes, agree. Guys, what doctors say is truly right. We don't get the sickness become very ill. Only we go and consult a doctor. It will become a very difficult conditions for them, for the healthcare to handle you as well. Okay, thanks Dr. Liew for tonight's session, and thanks to you guys that is still staying with us. And those that actually still stay with us, please do click like at our Erufu page, and please do also help to share out today live so that more people actually can benefit for it. And never forget that we also have Erufu page in Chinese and Bahasa Melayu. Do like and follow if you need. Before I end, I would like to inform you that this coming Wednesday, we will be having a topic by the dentist, Dr. Goh Xiong Ling, to talk about COVID-19. Is it safe to visit your dentist for dental treatment now? 新冠肺炎期间你去看牙医做牙科治疗安全吗? So it will be presented in Mandarin. So for more information, please check out our announcement post in Erufu page. And right clinic, the right doctor, the right care, the right information, the right knowledge. No panic, stay at home. Good night, everyone. Good night, Dr. Liew as well. Bye. See you guys next Wednesday.